From the age of 50 onward, the body begins to send clearer signals about its state of health. This stage of life is usually accompanied by normal physical changes resulting from natural aging. The skin loses elasticity, metabolism becomes slower, joint pain may appear, and of course, vision also begins to change. Many adults notice they need to hold reading material farther away to see it clearly. Others require more light to perform daily tasks. Some begin to experience difficulty driving at night, or feel that colors no longer appear as vivid as before. In most cases, these changes are expected and part of the natural biological process. However, there are situations in which a visual symptom may be more than just a simple effect of aging. On rare occasions, certain changes in vision may represent a warning sign of a systemic disease, including cancer in another part of the body. One such scenario is ocular metastasis. Although it is not common, it is important to know about it, understand it, and recognize when a symptom deserves immediate attention. The goal of this information is not to create fear, but to promote awareness and prevention. What exactly is metastasis? To understand ocular metastasis, we must first understand what metastasis is in general. The human body is made up of billions of cells that constantly divide and renew themselves. This process is strictly regulated by biological mechanisms that control when a cell should grow, divide, and die. Cancer develops when these control mechanisms fail. Some cells begin to multiply without regulation, bypassing normal cell death processes. Over time, these cells can form a mass called a tumor. The tumor that forms in the organ where the problem began is called the primary tumor. In some cases, cancer cells acquire the ability to invade nearby tissues and later enter the bloodstream or lymphatic system. When this happens, they can travel to distant organs. If these cells implant in a new organ and begin to grow there, what is known as metastasis occurs. It is essential to understand that metastasis does not mean the cancer changed type. It means the original cancer has spread. For example, if breast cancer spreads to the eye, it is still breast cancer. If lung cancer reaches the eye, it remains lung cancer. Treatment will always be guided by the type of primary cancer. Why can the eye be affected? It may seem surprising that the eye, a relatively small organ, can become a site of metastasis. However, there is an anatomical and physiological explanation. The eye is composed of several layers. Sclera, the outer white and resistant layer. Choroid, the middle layer rich in blood vessels. Retina, the inner layer responsible for capturing light and converting it into nerve signals. The choroid has an important characteristic. It contains one of the most abundant networks of blood vessels in the body. This intense blood supply properly nourishes the retina, which requires a large amount of oxygen and energy to function correctly. However, this same vascular richness makes the choroid a potential implantation site for tumor cells traveling through the bloodstream. When a circulating cancer cell finds a favorable environment, it can adhere to the tissue, multiply, and form a metastatic lesion. Most ocular metastases are located in the choroid. Is ocular metastasis common? In the general population, ocular metastasis is uncommon. It is not a frequent cause of visual problems. However, among people who already have cancer, it may occur more often, especially with certain types of tumors. The cancers that most frequently produce ocular metastasis are breast cancer, the leading cause in women; lung cancer, the leading cause in men; prostate cancer; colon cancer; kidney cancer; cutaneous melanoma. In some cases, the patient already has a cancer diagnosis when visual symptoms appear. In other situations, the ocular symptom may be the first sign that a tumor exists elsewhere in the body and has not yet been detected. This highlights the importance of not ignoring unusual visual changes. Normal visual changes versus warning signs. After age 50, certain visual changes are completely normal. Presbyopia, difficulty seeing up close; progressive cataracts; dry eye, mild decrease in contrast perception, increased sensitivity to glare. These changes usually develop slowly and gradually. In contrast, certain signs require closer attention: progressive blurred vision in one eye, a fixed dark spot in the visual field, image distortion, rapid vision loss over weeks or months, flashes of light accompanied by vision loss, persistent sensation of eye pressure. The main difference often lies in the speed of onset and asymmetry. When a symptom appears suddenly or affects only one eye, it deserves immediate evaluation. What are the symptoms of ocular metastasis? Symptoms may vary depending on the size and location of the lesion. Some patients experience blurred vision. This is the most common symptom. It may be mild at first and worsen progressively. A fixed spot or shadow. A sensation of having a cloud in part of the visual field. Visual distortion. Straight lines may appear wavy. Decreased central visual acuity, if the lesion affects the macula. Eye pain. Less common, but possible if inflammation is present. In some cases, there may be no symptoms in the early stages, and the lesion is detected during a routine eye examination. Why can the eye be the first sign of cancer? The eye has a unique diagnostic advantage. It is the only organ where doctors can directly observe blood vessels and internal tissues without surgery. Through a fundus examination, the ophthalmologist can detect abnormalities that in other organs would only be visible with complex imaging studies. During this exam, the following may be observed: elevated lesions in the choroid fluid accumulation beneath the retina secondary detachments, abnormal vascular changes. If the ophthalmologist identifies suspicious characteristics, additional studies may be recommended to investigate the possible presence of a primary tumor in the body. In this way, the eye examination can become an early detection tool. The importance of comprehensive evaluation. When a suspicious lesion is detected in the eye, the approach should not be limited to local treatment. Health does not function in isolation. The body is an interconnected system. A comprehensive evaluation may include complete medical history, family history, general physical examination, laboratory tests, body CT scan or MRI, oncologic evaluation. The goal is not to create alarm, but to rule out or confirm systemic disease. Early diagnosis may allow less aggressive treatments, greater disease control rates, improved quality of life, preservation of vision, emotional impact. Hearing the word cancer generates fear. This is a natural reaction. However, it is important to remember, not all visual symptoms indicate cancer. Not all ocular lesions are malignant. Modern medicine offers advanced treatments. Early detection improves prognosis. Avoiding consultation out of fear can delay diagnosis and reduce treatment options. Seeking medical evaluation is an act of responsibility, not weakness. Age as a risk factor. After age 50, the risk of developing cancer increases for multiple reasons. Accumulation of cellular damage, reduced immune efficiency, prolonged exposure to environmental factors, hormonal changes. This does not mean that all older adults will develop cancer, but it explains why regular medical checkups are essential at this stage. Ocular metastasis is an uncommon but significant condition. In some cases, it may be the first sign of cancer elsewhere in the body. After age 50, any persistent or unusual visual change should be evaluated by a healthcare professional. Information allows us to act with awareness, without panic, but without ignoring important warning signs. How is ocular metastasis diagnosed? When the ophthalmologist detects a suspicious lesion during a fundus examination, the next step is to perform additional tests to confirm its nature. The diagnostic process usually includes several tools. Ophthalmologic examination with pupil dilation allows detailed observation of the retina and choroid. The doctor can assess the size, shape, color, and characteristics of the lesion. Ocular ultrasound, a painless test that uses sound waves to obtain internal images of the eye. It helps measure the thickness of the lesion and analyze its internal structure. Optical coherence tomography, OCT, provides high-resolution images of the retinal layers. It is especially useful for detecting subretinal fluid or macular changes. Fluorescein angiography evaluates blood flow within the eye and may show characteristic patterns of certain tumor lesions. If these studies suggest metastasis, the search for the primary tumor continues with computed tomography, CT, scan of the chest, abdomen, or pelvis, magnetic resonance imaging, MRI, mammography in women, chest X-ray colonoscopy, or other tests depending on suspicion. In some cases, the ocular lesion is the first finding that leads to the diagnosis of the primary cancer. What happens if cancer has already been diagnosed? In patients who have already been diagnosed with cancer, any new visual change should be reported to the treating physician. In these cases, the ophthalmologist and oncologist work together. Treatment will depend on type of original cancer, extent of disease, general condition of the patient, number of ocular lesions. Coordination between specialties is essential to provide the best therapeutic approach. Treatment of ocular metastasis. Treatment does not focus only on the eye, but on the entire systemic disease. Options may include systemic chemotherapy, acts on cancer cells throughout the body. In many cases, by controlling the primary tumor, the ocular lesion also decreases. Localized ocular radiotherapy, used when the lesion significantly affects vision or does not respond adequately to systemic therapy. Hormone therapy, common in hormone-sensitive breast cancer. Targeted therapies act on specific molecular alterations of the tumor. Immunotherapy stimulates the immune system to attack cancer cells. In many current cases, combining treatments reduces the ocular lesion, improves vision, and controls the overall disease. Medical advances in recent years, oncology has advanced extraordinarily over the past 2 decades. Today, there are personalized treatments based on the tumor's genetic profile, less toxic and more selective medications, high-precision radiotherapy, combined protocols that improve survival. Many diseases that once had a poor prognosis can now be controlled for years. Early detection remains one of the most important factors for improving outcomes. Prognosis. What you should know. Prognosis depends mainly on the primary cancer and the degree of spread. Factors that influence prognosis include type of primary tumor, presence of metastases in other organs, response to treatment, age, and general health condition of the patient. It is important to remember that each case is unique. Not all metastases behave the same way. Modern medicine can, in many cases, transform cancer into a controllable chronic disease. Can ocular metastasis be prevented? There is no direct way to prevent ocular metastasis itself. However, it is possible to reduce the risk of developing certain cancers. Preventive measures include not smoking, maintaining a healthy weight, engaging in regular physical activity, eating a diet rich in fruits and vegetables, reducing alcohol consumption, undergoing recommended screening tests. Primary prevention reduces the risk of cancer development. Secondary prevention, early detection, improves prognosis. Associated systemic symptoms. In addition to visual symptoms, some individuals may experience persistent fatigue, unexplained weight loss, chronic cough, bone pain, changes in bowel habits, palpable lumps or masses. If visual symptoms are accompanied by general manifestations, medical consultation should be even more urgent. Impact on quality of life. Vision is essential for independence and safety. Visual impairment can affect reading, driving independence, balance, emotional well-being. Therefore, preserving visual function is an important goal within comprehensive treatment. Even when systemic disease is not curable, controlling the ocular lesion can significantly improve quality of life. The role of self-care after age 50. Reaching 50 is a stage of experience and maturity. It is also a key moment to take an active role in healthcare. Self-care includes not minimizing persistent symptoms, not self-medicating without evaluation, attending regular checkups, following medical recommendations. Listening to your body does not mean living in constant fear, but acting responsibly. Key differences between normal aging and medical alarm. It is normal to need reading glasses, develop cataracts gradually, experience mild dry eye. It is not normal to lose vision suddenly, see a fixed shadow that does not disappear, experience rapidly marked distortion, have constant eye pain. When in doubt, consulting a doctor is always the best decision. The importance of annual eye examinations. Many people visit the ophthalmologist only when they need new glasses. However, an annual eye exam can detect glaucoma, macular degeneration, diabetic retinopathy, vascular alterations, suspicious lesions. The eye can reveal information about cardiovascular, metabolic, and oncologic health. Risk factors to consider. Some factors increase the likelihood of cancer: long-term smoking, family history, exposure to pollutants, sedentary lifestyle, poor diet age over 50. Modifying habits can significantly reduce risk. Fear and the importance of acting. Fear can become an obstacle. Some people avoid medical visits out of fear of a negative diagnosis, but delay can reduce treatment options, increase complications, worsen prognosis. Consulting in time offers more possibilities. Ocular metastasis is uncommon, but possible. On rare occasions, a visual symptom may be the first sign of cancer elsewhere in the body. After age 50, health monitoring should become more conscious and systematic. It is not about living with anxiety, but with information. If a persistent visual change appears, do not ignore it. Do not automatically attribute it to age. Seek professional evaluation. Most visual symptoms will have benign causes, but when they do not, early detection can save lives. Vision can be a window into the body's overall condition. Acting in time can make the difference between a late diagnosis and a real opportunity for early treatment. Information is prevention. Prevention is responsibility. Responsibility is life.